We're going to get into a crappy topic about taking GLP-1 medications today. But before we do, I want to introduce myself. I'm Dave Knapp. I'm the man of the Mounjaro. That's why I'm here. I'm here to talk about all things incretin mimetic therapies. I'm not a medical doctor. I do not give medical advice. I just am a person who uses these medications, who interacts with thousands of others on a daily basis who are also on these medications. And I want you, above all else, to know that you're not alone in what you're experiencing. Others have too. And I want to equip you with some information to provide the most competent and confident conversations that you can possibly have with your medical care team. So let's get into it. Constipation is one of those awkward topics that comes up a lot of times. It's one of those things we oftentimes don't want to seek care for because it's an embarrassing thing. We don't want to talk about it publicly because it's an embarrassing thing. But the reality is there are some serious side effects with these medications that you don't want to let go unnoticed if you're really struggling. So let's talk about the mechanism of action about delayed gastric emptying. That is a actual mechanism of action. It is by design something that GLP-1 and incretin mimetic therapy medicines do by design. They slow down your gastric emptying. In doing so, you're processing the food that you eat in a much slower way. You're also consuming less calories for most people because the food noise has been turned off. In doing so, your bowel habits are going to change. But what is normal? And so I get this question a lot, and it's hard because you know what's normal for you. Nobody else really knows that. But in general, a good rule of thumb is if you're experiencing constipation that isn't alleviated with some of the normal remedies, we talk a lot about MAG-O7 over here. We talk about, just some different supplements that you can take that oftentimes help people. Obviously, you want to consult with your doctor before you use any of those. But in general, after a couple of days of no bowel movement, you're going to want to make sure that you talk to your doctor so that you can be at a minimum monitored over the course of your treatment period to know what is normal for you and when do you need to seek treatment. Because this is one of those things that if it gets serious and it's left untreated, it can become very problematic for people. So in general, after a couple of days, make sure that you consult with your physician, your primary care doctor, so that you can discuss what the right treatment is going to be for you and the right course of action. But know that you're not alone in this. Many, many people experience the unpleasant side effect of constipation. Again, there's some sense of normalcy to it because your bowels have been slowed down. You're consuming fewer calories. So there are probably going to be changes to your bathroom habits. But in general, after a couple of days, make sure that you consult with your physician so that you can seek the right course of treatment. For more videos and more information on some of the common side effects, check out my playlist for GLP-1 side effects. We're going to cover all of them here on this channel. And I hope that you'll hit that like, hit that bell, and hit that sub so you can stick around and enjoy some of the content that we do here at On the Pen. Catch you next time.